Hi everyone. So today I'll be discussing a situation wherein we see that the primary canines or the milk canine is lost or are lost. Then actually this situation is worth discussing because parents think and take it really lightly that fine milk teeth fall and permanent teeth set do come, so there's nothing to worry about. Yes, there's nothing to worry about, but if you see that the milk teeth, that means the milk canine, is falling prematurely, that means way before it is supposed to fall, then there is something significant that it is prompting to, and one should pay attention to. Now, the most common reason for this to happen is the ectopic eruption of permanent lateral incisor. Now, what does this mean? So many new terms: ectopic, permanent, lateral incisor. So, see, in this diagram, if you can see, the permanent lateral incisor is just below the primary or the milk lateral incisor, and it's present inside the bone. Now, when it starts to erupt, and it is erupting ectopically, that means it is not erupting in its position where it should erupt. Instead, it is deviated from its normal position, and it is, let's say, erupting in the direction where the milk canine is already present. Now, if that happens, what happens then is the roots, as you can see in the second diagram, which I've denoted as B, that shows that because of the abnormal inclination of the permanent lateral incisor, it is causing the roots of the canine teeth, that means the milk canine tooth, the roots start to resorb. Because of that, the primary canine is lost prematurely. And when that happens, what happens is the whole lot of thing that we'll be seeing later. But why is this significant? Like, why it is so important to discuss if this happens? Why? Because this indicates that in future you are going to face a situation that is called as crowding. That means there is some discrepancy between the tooth size and the arch size. That means, see, an aligned arch wherein there is sufficient amount of space present for the tooth or teeth, the arch is aligned. But in situation wherein there is tooth size or arch size discrepancy, that means either the arch is small and the tooth size is big, or the tooth size is normal but the arch size is small, either of these situations will result in crowding. Because there is discrepancy in tooth size and arch size, that is why it can be a cause that the permanent lateral incisors were erupting in a deviating position, which is why milk canine got lost. So all of that story that I mentioned before. Then, see, the first thing that happens if unilateral loss, that means if canine is lost at just one side, either of the case, if canine of the upper jaw or the lower arch is lost on one side, there will be a shift in the dental midline towards the side of loss. That means where the loss has happened, whichever side the loss has happened, the shift will happen towards that side. Now, if you can see, the upper arch has got one midline and the lower arch has got one midline. Both of the upper and lower arch should coincide to form a proper symmetric dental midline. But if this shift happens, as you can see, the red dashed line shows the midline of the upper arch, and the green solid line shows the midline of the lower arch. Because there is a shift, these two are not coinciding. So this is the first thing that happens. Second thing that happens is the entire incisor segment, that means the entire front four teeth, they will start falling backwards. The picture that I've attached is of the lower incisor segment. That means if the lower canines have lost or is lost, let's say, because we are discussing about unilateral loss. Now, when a unilateral loss happens, what happens is the entire, let's say if lower canine is lost, then the entire lower incisors will try to fall back. Why does this happen? Because body has this tendency of closing the space. So in an attempt to close the space, what will body do? Body will send signals, and because of which the entire four incisors will go back. They'll fall back. So that is called as lingual collapse of incisor segment. Then what happens? Then there'll be deepening of bite because the incisors are falling back. What is it causing? It is causing vertical collapse also because the front teeth are falling back, no? So that will cause deepening of bite. Then what happens? Because this asymmetry has happened, this asymmetry will also complicate the future eruption of permanent canines and permanent premolars that was to erupt at the space of primary canine or the milk canine. So this also happens. What kind of complication? It can, maybe the permanent canines will erupt somewhere else, like I've shown you. That is called ectopic eruption. When it is erupting anywhere other than its normal place, it's called as ectopically erupting. Like here in the photo that you can see, the right permanent upper canine is erupting ectopically. So this is there. Now if the loss is bilateral, that means the loss of canine is bilateral. That means canine either in the upper arch or in the lower arch has happened on both the sides. If that happens, whatever consequences we have learned in the unilateral loss of primary canine, all of it will be there, but in an exaggerated manner. That means even severe will the changes be. And together with those changes, there will be a significant loss of arch perimeter. Arch perimeter, that means those red dashed line that you can see. That means the entire length along the arch. That's called as the arch perimeter. That will be lost. Okay. Then, now what to do? Now we have understood that yes, if not treated, if not taken care of at the right time, all of these things can happen. So what can we do to prevent it? For prevention, for managing it, there's something called as a lingual holding appliance. It has got spurs that you can see. Those spurs, those metallic extensions are extending on both the sides of the entire incisor segment. That means entire front teeth segment. So this will hold the front teeth in its place. This will hold the molars in their places so that the molars don't end up falling forward and cause further decrease in the arch perimeter. So this will basically maintain the arch perimeter. This will maintain the situation and will not let crowding get worst. Okay. Now, and let's say you missed it and all of these changes have already happened, the bad results have occurred. Then in that case, we'll have to wait till we actually are able to get the permanent fixed orthodontic treatment get done. That means those with wires and braces will ultimately correct the situation. But then, if you are aware and you manage the situation at that particular time with a small appliance only, the entire situation can be handled. But if you delay it and if you're not aware of it, if you're not knowing it, then when it comes to permanent fixed orthodontic appliance, it's very difficult. That treatment anyways is very long and it takes a lot of time. It's very difficult for the patient also to cooperate. So that's it for now. I hope you understood it, because my main intention is to make common man understand the dynamics behind the treatment and the cause and the problem that has already happened. So take care. If you have any problem, any doubt, anything you want to know extra, you can let me know in the comment section. Till then, take care.